Hello everyone, my name is Mihirwala. This video is part of my rubrics examination. So today we're going to learn about Granulomatous Amebic Encephalitis. This is extremely serious infection in the brain. Imagine an organism, a small that can be seen with the naked eye, but once it enters into brain, it can destroy the brain tissue and becoming the life-threatening. GAE is caused by the free-living amebes found naturally in the soil, fresh waters. Granulomatous amebic encephalitis is caused by a free-living amoeba found in the natural soil, fresh water, dust, contaminated water, a very high mortality rate, and requires early diagnosis and treatment. Sensitive organism. The main organism causing a granulomatous amebic encephalitis, Amoeba, most common cause, and the Balmuthia mandaralis. These amoebic naturally live in the environment and usually do not cause any disease in the healthy individuals. However, people with the weakened immunity, they can invade this body. We'll see mode of transmission. How does infection occur? Amoeba may enter through inhalation, through the respiratory tract, a broken skin wound, rarely through the contaminated water. After the entering into body, it spread through the bloodstream. Eventually, it reaches up to brain. Once inside the brain, inflammation develop and granulomatous form. That's why we are calling a granulomatous encephalitis. Why it is so dangerous? Why it is lethal? This disease considered as one of the devastating infection because symptoms are gradually worsened. Common symptoms are severe headache, fever, seizures, we can say a weakness, paralysis, confusion, loss of consciousness. As a brain tissue become damaged, increased intracranial pressure may occur. Without rapid diagnosis and treatment, the disease can progress to the severe neurological damage and may become a fatal. Diagnosis and treatment. Diagnosis is difficult because it resembles symptoms of other neurological condition also. A method include a brain imaging like MRI or CT scan, a microscopic examination, molecular test like a PCR, tissue biopsy in other areas also. Treatment usually combines with the multiple antimicrobial drug, supportive care, and intensive neurological monitoring. Early detection greatly involves outcomes. We'll see the role of physiotherapist. As a physiotherapist, our role is mainly during the recovery and rehabilitation. We can give a functional rehabilitation for the activities of daily living, like we can give a balance and gait training. We can give a passive and active range of motion exercise, etc. etc. Now, to conclude, granulomatous amebic encephalitis is a rare but the highly destructive brain infection caused by a free-living amoeba, and early recognition and the multidisciplinary conclusion. To conclude, granulomatous amebic encephalitis is a rare but highly destructive brain infection that caused by a free-living, and early recognition and the multidisciplinary management and rehabilitation is essential to improve the survival and the recovery. Thank you for watching.